Welcome to the Benefits Executive Roundtable, hosted by Dorothy Cociu, President of Advanced Benefit Consulting. Dorothy is a nationally recognized benefits and compliance consultant and group health broker. Here, you will watch and listen to industry experts who will break down the latest trends in employee benefits, healthcare reform, state and federal legislative and regulatory activities, all designed to empower executive decisions. We are proud to bring to you all new video podcasts. We hope that you enjoy your new video podcast format, and please forgive any audio or video imperfections. Thank you for viewing and listening.
Welcome to the Benefits Executive Roundtable. I'm your host, Dorothy Cociu, President of Advanced Benefit Consulting, and I want to welcome my guest back today, Maggie Stedt of Stedt Insurance, who is a Medicare expert, of course, past president of the California Agents and Health Insurance Professionals, CAHIP, past president of the Orange County chapter, CAHIP Orange County, and also a Medicare Advisor Task Force Emeritus Member for the National Association of Benefits and Insurance Professionals. Welcome back, Maggie. You joining me again. This is like an annual thing now, so happy to have you back for season 7. Thank you for joining me.
Oh, Dorothy, I'm delighted. There's so many changes, and I call this Fall Festival.
Yeah.
It's just a crazy time. And it's if I can provide any insights and help to folks, that's the name of the game today. Yeah. So it doesn't make it as scary and foreboding.
Exactly. Well, Medicare is such an important topic for so many people, right? And there's obviously more people turning 65 all the time, and family members want to know how to help them, and agents need to help them, because if they don't, I don't know honestly what they would do without them, because it's just way too confusing and complicated. Because let's face it, not all Medicare aged individuals are that computer savvy. I mean, a lot of us are when we get up into the upper ages, but some of us are not. I mean, some people, as they get into their 60s and beyond, they just don't spend a lot of time using computers and smartphones and so forth. So it's really difficult. And when someone says, just do it yourself, enroll yourself, that's pretty difficult. So we're going to talk about what's new, what's continuing, what's new, and so forth, like we do every year. This is, as I said, been an annual thing for quite some time, and I keep inviting you back because you are the most knowledgeable person that I know on Medicare issues, and so I always want to make sure to have you with us every year, because again, people appreciate the information that you provide, and you're so up to speed, so up to date on every single thing. So another year, another set of new rules, of course, for agents selling Medicare plans. And as usual, I just have to ask this, because we talked about this quite a bit last year. There's always a lot of confusion and frustration and stuff going on, but last year it was very emotional and very frustrating, and I called it despair, because agents, basically their compensation was getting cut drastically. So I want to start off by asking you that question this year. What's changed, if anything has changed since last year? Has it gotten any better for agents that are trying so hard and so desperately to help their clients, but sometimes they're just not getting paid for it? What's going on there?
It's even worse. So what has happened, and this is really affecting people, we've gone from 15 standalone prescription drug plans available in California down to 11. And out of those, only one is paying the agent's commissions for new sales.
Oh,
there are 3 or 4 of them that will continue paying commissions if people stay on their current plans. The bad news is those plans are well close to $200 a month in premium. So many agents are really struggling with this. And through August and September, when I was in meetings with agents and so on, they're saying, how are we going to do this? Because it takes quite a bit of time and effort to make sure your clients are on the right drugs plan, and that their drugs are covered and they know the steps. So it can be anywhere from an hour to an hour and a half to take care of the client, and now the agents are not being compensated for it. Many of the agents, such as myself, are saying, hey, they're my clients. Drug is an important piece of what we're doing, right. So I am continuing to service my clients. The other reason why I view it as very important that I'm still enrolling my clients in these plans is because if I am the agent of record, I can help my clients with customer service or any issues that they have. If I'm not, I can't.
Yeah.
And so that is what many of us agents are doing. Those of us who are trusted advisors have said, we are not throwing our clients to the wolves.
Right.
we have a number of new agents that just aren't experienced and know, and it probably is just as well for them to train their people, their clients, on how to use Medicare.gov and how to look up things. So, in fact, a couple of the large FMOs like Warner Pacific has provided training videos for actually consumers to help them understand how to access and enroll using the Medicare.gov website. The only disadvantage is you don't have a trusted advisor to help you with that.
Right.
And, and I don't want to throw the companies under the bus to say, oh, they're being mean and evil. This is financial people. Yeah. What has happened is because of the Income Reduction Act, they have changed the allocation of costs so that companies are picking up 60% of the cost of the drugs once people hit their max out of pocket. So it's a tremendous amount of pressure on the companies to be able to continue to provide prescription drug plans or strong prescription drug coverage. So in the area of compensation, there's also a number of MAPD or Medicare Advantage plans, especially the PPO plans, that will not be paying commission as well. And throughout the country, there's a lot of plan withdrawals, and also a great number of plans are not paying commissions to agents. But I will tell you, most agents are saying, we know we've got to bite the bullet, but we have to take care of our clients.
Right. And the more this goes on, and the longer this goes on, and the more products it affects and so forth, I mean, you guys aren't being compensated, but you're still helping your clients, as you said, at least those that want to, like yourself. You can't work for free forever. You can't do this stuff. I mean, you've got to be able to, we're in the middle, as we're recording this, we're in the middle of a government shutdown right now. And there's a lot of controversy, of course, going on across the country about that. And they're worried about whether they're going to get, when they can come back to work so they can get retro payment. But there's no retro payment here for you guys. There's nothing that when you do go back to work, you're going to get paid. You're going to be working the whole time, all through the Medicare seasons and so forth, and all throughout the year, this year and any other year, helping your clients without compensation. And I just want to make sure people were aware of that, because if people are watching or listening to this podcast, and if you have any say-so anywhere, that perhaps you can, say how important it is to have agents that are very knowledgeable assist your clients, because it's just impossible. I mean, I like I said, I know a number of seniors that just can't do it on their own. No. So I applaud you, Maggie, and I applaud the agents that are continuing to advise and continuing to help their clients, even though they're getting very little, if any, compensation on some of these products. And obviously they're getting paid on other parts.
Right, exactly.
Yeah, but still, I mean, you're still working for free for a lot of what you're doing for your clients. And I just want to make sure people were aware of that and see where it stood this year compared to where we were last year when we talked about it. Because now by the time this podcast is released, we're going to be right smack dab in the middle of the open enrollment season. So I thought it was really important for people to understand that.
And one thing I do want to add is we cannot accept any payments outside of our normal commission amounts. And so agents are not allowed to charge a consulting fee, especially in the state of California. And so any agent who tries to charge someone, we want to know about it.
Yeah.
Because that is illegal. When I was president of the association, we actually worked with a couple of companies and went after some groups that were charging people up to $300 to $400 for a consultation to go on Medicare. Wow. I'm going, seriously. So there's always someone figuring out some way they can make additional monies, but individuals should not offer any consulting fees nor charge consulting fees.
And those that are watching or listening to this podcast, if you know of anyone that's helping, for example, a family member of yours or yourself, and they're asking for those fees, be advised they're not supposed to do that. That is not something that they're allowed to do. So again, I'm glad actually that people are calling them out and saying, hey, you can't do that, because somebody has to monitor that sort of thing. So if you're working with somebody that's charging you, you need to say to them, you're not supposed to charge me any money for helping me for this. You can't charge fees, only the commissions and so forth that you get paid directly from the carriers and so forth. Well, let's go back a little bit and start with the basics. I wanted to start with that because it was a really important concept, and we ended the podcast last year on that, so I wanted to come back to it at the beginning. But let's go back and start from the basics a little bit for our audience members that may not have listened to the podcast in the past on this topic. The Medicare plan options available to Medicare enrollees is vitally important, obviously, because it affects the type of coverage that they're going to have in 2026 and beyond. I ask you this every year. I'm going to ask you again. What would you say are the most important things that consumers need to know to help themselves, their families, their friends, and others that are about to turn 65 or are 65 or older and eligible for Medicare?
Number one, don't be so scared of it. It seems like it's all new terms, all new languages, and all the things. It's a financial decision, but it's also a decision of we need to keep you with your doctors. We need to make sure your prescription drugs are covered. We need to know if you're traveling. We have to know what your basic needs are. So many people get hung up in the weeds. They get concerned about all these, and you see them on ads on TV. Oh, transportation, dental, vision, all of this. You really need to take it a step by step and say, what are my medical needs? Who's the doctors I need to see? Are my prescriptions covered? Then we talk about the other added benefits. This year, a change has been that the grocery benefit that they've advertised for a number of years and sounds so thrilling, get your benefits, are only going to be available to people that meet special criteria, such as chronic conditions and that type of thing. So you'll notice on the TV ads, they aren't pushing them so much. But the main thing when you're new to Medicare, it's the timing. You have to make sure that you're applying within the times you should be applying. So it's kind of, when I do my T65, turning 65 meetings, I kind of look at it. You got to understand, what is Medicare? How does it work? And so the Medicare New booklet that you can find on the Medicare.gov website or you get in the mail, that is the booklet that tells you what Medicare covers. That is your best resource. So Medicare New will tell you that, and you have access to that. So first, figure out, what is Medicare? The other question you have to ask, do I really need to go on Medicare? If you're working for a large employer and the coverage is great and it's creditable, it covers the drug plans as minimally required by Medicare, you may not need to go on to a plan. So why spend that $185, which is going up to about $206 next year, a month for Medicare Part B if you don't need to go there? You can always get your Part A, and there's no charge for A. So, it's a consideration. So the first thing is, do I need to go on Medicare? How do I go on Medicare? It's not that hard. You can go through socialsecurity.gov and apply. You can make an appointment at the Social Security office. You can call Social Security directly to enroll in Medicare. If it's after age 65, we do have some other forms and things to do. But the main thing is, what is Medicare? Do I even need to enroll in Medicare at this time? And if I do, how do I do it? And those are the things. And then once you have Medicare A and B, then we look at what's the best plan that fits my needs for this year.
Right.
This is not a forever decision, folks. This is this year. So each year.
It's a year-by-year decision, and they have to always be updated, and that's why you have to meet with them every year, and we'll talk about that more in just a moment, to make sure that everything that they're looking at going forward is, because what was right last year might not be right this year coming up, right? Yeah, the plans change and so forth, and the coverages change, and people need to be aware of that. Now, you mentioned one thing earlier, and I want to bring it up because we have talked about this in the past, and I do want to bring this up again. You mentioned large employers, it might be better for them to stay on the group plan. What if they're a smaller employer? What are your thoughts on that?
That really depends. Medicare wants people that work for companies with less than 20 people working at the company. Don't care if it's part-time or full-time. They prefer they go on to Medicare. Here in California, we have some plans that the employers may elect to cover their employees. We call them aged employees. So they may elect to cover them. So those people may have the choice to continue on their employees' plan. So people who work for a company of less than 20 employees really has to check with their employer and their company, the coverage, who's offering the coverage, to see if the contract will be covering them. If not, then they absolutely need to go into Medicare. There are other people that I always call them thou shalts. So if you're on Covered California, thou shalt go on Medicare. If you're on COBRA, thou shalt go on Medicare. If you're on an individual plan off exchange, thou shalt go on Medicare. So there are definitely some thou shalts, because if you don't, you could be subject to penalties and fines that will last as long as you have coverage,
right,
such as a Part D penalty or the Part B penalty. So penalties are very much there, and that's why timing is everything in Medicare.
Right, for sure. Well, again, remind our audience the difference between the open enrollment period that goes on here in the fall and the open enrollment period that goes on for January 1st.
So a number of years ago, Medicare established that we have certain enrollment periods. So in the fall, we have what is called the annual enrollment period. And that actually affects anybody that has a Medicare Advantage plan, which includes the Medicare PPO plans and standalone prescription drug plans. They have from October 15th to December 7th to change plans. And it's the last plan application that CMS has received will be the one that will be in effect for January 1. There's another enrollment period that starts January 1st and goes through March 31st. We call it open enrollment period, and that only applies to the Medicare Advantage plans, not the prescription drug plans, so that people can make one change during that time period. The difference is we agents can't do any marketing or selling. You have to call us during that time period, the OEP, if you wish to change plans. So, and then there's always the special enrollment periods which apply, and that's where an agent can really help you walk through that, such as you move, you lose coverage, that type of thing.
Right.
But open enrollment, I was kidding Dorothy and saying that I call it Fall Festival because it's such a crazy time. It starts October 15th and ends at the stroke of midnight on December 7th.
Well, thank you for that clarification. You do mention that every year. I always ask you that question every year because people get so confused by that. But I thought I already went through open enrollment. What's going on? They don't know the difference between the AEP and the OEP. So I want to make sure that they were familiar with that or remind them of that because, again, it's been a year, so they may have forgotten because sometimes if it's not right there in front of them, they aren't going to remember it potentially. So, well, let's go on to some other questions that I have for you. Again, as a reminder to those people who have watched or listened to the podcast in the past, what can seniors do specifically during the open enrollment periods?
I think the most important thing is if you're already under a Medicare plan, there's a notice that comes out from your carrier, and it usually comes out the end of September. It's called the Annual Notice of Change. We call it ANOC. And take a look at that. Don't throw it away because that'll give you a comparison of the changes in your plan from this year to next year. So that's step number one. Number two is to work with your agent and really assess what has changed in your life. Do you have some major surgeries coming up? Do you have some number of prescription changes? You've changed doctors? Are things not working well? Communicate with your agent and let you know, because we need to make sure you're under a plan that best fits your needs. On the other hand, if things are working well and your annual notice of change, everything seems like it's copacetic, you don't need to make a change. And just let your agent know, I'm happy. Let things continue. And if anything is happening, the agent will let you know. Now, on the other side, we do have some plans that are withdrawing. So there's a number of plans that the company are actually withdrawing them from the marketplace. And for some people, they're being crosswalked or moved to new plans. For others, they have to contact their agent to get a new plan. So if you get a letter from the companies, pay attention to any communications such as that so that you know that you need to take some action because we only have so many days to move you into a new plan. Right. So that's very important. The other thing I would mention is, would you ignore those TV ads? They're designed to get you agitated and excited. They're doing a little better this year, and I'll talk about it a little more when we talk about changes in the 2026 rules. They're not as bad as they've been in the past, but still, they just confuse people in many ways. They're marketing please people.
Okay, forget the ads. Okay, important thing, forget the ads. That's a lot of things. I mean, I tell people all the time, because a lot of my group clients are self-funded, and I tell them a lot of times that, hey, if it's a drug that's being advertised on TV, it's probably the most expensive drug in the category, and plan costs are going to go up if people use it a lot. So, just the same thing. Kind of ignore what you see on TV, I guess. That's kind of the rule of thumb. Well, you mentioned this earlier, and I want to come back to it. What's new this year for Medicare recipients? What do they need to know in preparation for this Medicare season?
Prices are going up, people. I mean, it's just like the rest of the life. So, for example, many of the Medicare Advantage plans are now introducing a deductible for your brand drugs. And so in prior years, Medicare Advantage plans, HMO plans, typically did not have a deductible. Last year, one carrier did introduce it. But this year, practically every plan has a deductible. It can range from $235 up to $615. So that means you have to plan in January, February, and March if you have any expensive drugs, such as Ozempic or Wegovy or any of these, Pelagrity, any of these big ones, you're going to be subject to the deductible. But once you meet your deductible, then you'll be going to the copays and coinsurance levels. There's also been a change in a number of the plans where they've changed on the brand drugs from a set copay to a coinsurance amount as well. Also, formularies have changed quite a bit as well. There's also more need for step therapy that they've imposed, and also pre-authorization. So we have to make sure, you'll see it as an ST for step therapy. That means you have to try generic drugs before you do the big drug. Or for pre-authorization, it shows up as PA. So we need to pay attention to that on our formularies. You always get your first month without any pre-authorization required or step therapy, but it's that second month, all of a sudden the pharmacy says, oh, I can't give you this. We need to have pre-authorization. So just be aware that this is a year to really pay attention to the drug plans. Also, a number of carriers have taken away some benefits. There are some that have not. So people that have had vision and hearing may not have it this year.
Wow.
They've had transportation. They may not have it this year. That's why I want you looking at the annual notice of change to see what are these benefits you use and that are really important to you.
Yeah. Well, thank you for that information. I was not aware of some of that, quite a bit of that actually. So you mentioned deductibles, and I'm curious, what's the range? I know they all vary depending on the product and the carrier and so forth, but what kind of range of deductibles are you talking about here for those drug plans?
It's, as I mentioned, it's $235 to up to $615. There are some they're a little bit lower than $615. There's a few at $300.
Okay.
There's one at $235, somewhere in there. But a lot of the plans are going to the set deductible that's on practically all the prescription standalone plans at $615.
Okay. Well, thank you for that.
And that's an annual deductible.
Right. Thank you for that clarification. I appreciate it. And again, as I ask you every year, what are the most common questions that seniors have when they're signing up for Medicare for the first time?
I think a lot of times they get confused about the Part B deductible, which is $257 this year. Next year, it's going to be going up a bit. We find out around November 7th, right in that time frame, on what the actual amounts will be. But that's a one-time deductible for Part B. That's not a every month. They get confused with that. A lot of times they get confused at how am I paying for my Medicare Part B? Well, if you're receiving Social Security, it's deducted out of your Social Security monthly payment. If you're not, they're going to bill you quarterly. I don't want to pay quarterly? Well, you can go in and set up My Medicare account and set up to have it paid automatically through your checking account. Those are some of the key questions. The other thing that they're very concerned about is, can I see my doctor? And I say, it depends on the plan you're on when to see your specialist, whether you need a referral or not. HMOs? Yes, you do. PPO plans? No. Medicare supplement plans? No, you can go to see the doctors. Not to say you don't need doctor's orders for specific treatments, but it just depends on the type of plan you have as to how you access your doctors.
Well, thanks for keeping us informed on that. I really do appreciate it. Those basics that I think everybody wants to know. I'd like to turn now to what's new in Medicare. We've already talked about some of it, but can you tell us about changes this year for Medicare beneficiaries?
Well, I think the main thing is just the plans are really changing some of their benefits as to what they're offering and not offering. Medicare itself is really taking a hard look at expenses by the hospitals and billings and type. So there's a little more pressure on the doctors and the hospitals. But I think for the beneficiaries themselves, not a lot of changes in that type of area. Just, I think mainly understanding what benefits are and aren't covered. You're not going to get an annual physical exam, the whole head to toe. Typically, it's what Medicare determines you need for coverage. There are some plans that will offer that, but most of the time it has to be related to a condition. That catches a lot of people. A lot of people aren't using their benefits. There's a lot of benefits to me. We really want to see that you're using the wellness benefits, getting your mammograms, the PSA tests, getting those type of things, getting your flu shots, get that shingle shot. All of those, they're making sure you still have access to those benefits. So a lot of the plans are taking and even giving you some extra monies or cards so that you can do those wellness exams. They're rewarding you for taking care of yourself. So I think the most important thing for you to do is to take a look at your plan and utilize those benefits to make sure that you're doing the best you can to keep yourself well.
Great.
They're designed to do that.
Yeah, exactly. Well, thank you very much. We're going to take a quick commercial break right now. When we come back, we're going to talk about prescription drug changes and a lot more information. So we'll be right back.
Meet Advanced Benefit Consulting, an award-winning boutique benefits broker and compliance consulting firm that offers comprehensive benefits and compliance consulting. We offer personalized service and the ability to work directly with the owners. We invite you to contact us or connect with us on LinkedIn and include us in your broker consultant search.
Welcome to EBAN, your trusted partner in benefits administration for over 50 years. Programs include traditional self-funded plans, level-funded plans, HRA plans, and ACA compliant plans. Contact us today for more information at eban.com, 1-800-249-8440.
Welcome back. I want to talk now about prescription drug changes. Last year, you said there were a bunch. We talked about quite a bit of it. What's the status this year? Give us the latest, if you wouldn't mind.
Well, as we were talking about before, deductibles are higher. Formularies, a little bit less. They're really pushing more generic drugs, more use of step therapy, more use of pre-authorization. However, fortunately, many of the plans are still offering great coverage for the standard brand drugs that people take. And because of the negotiations that Medicare can now do on a number of drugs, we're going to see some costs go down for drugs like Januvia. So you'll see less out-of-pocket costs, and if you're on a co-insurance level on that. So that's some real positives this year that we've been affected with that. So on the drug plans, just be aware that formularies change. That's the main thing. And also pay attention to the pharmacies. You need to know, is the pharmacy a preferred pharmacy or does it show as a standard pharmacy? What that means is you'll pay higher copays for a standard pharmacy than you will with a preferred pharmacy. Some of the plans contract with CVS, some with Costco, some with Walgreens. So you need to pay attention to that because over the year, it could make quite a few $100s in benefits to you. The other thing is you really need to think about brand versus generic. The main difference between generic drugs and brand, the formula is pretty much the same, but it's the binders a lot of times that put the pills together. And sometimes people are allergic to the binders. So you and your doctor need to work to make sure, can that generic really work for me? Or do I have to have the brand drug? Don't use the brand just because you've always used the brand. This is something you should work with your doctor. We're talking hundreds of, maybe even thousands of dollars of difference.
Right.
So you need to take care of your health. It's a decision between you and your doctor, but at least the formularies are there to help you figure out what makes the most sense for you.
Okay, great. And continuing on the prescription topic a little bit, I want to ask another question about this. Share with us, if you would, information about the drug payment plan, the Medicare prescription payment plan. Will that be available either on a standalone basis or on a Medicare Advantage plan? How does that work? How do you enroll? What's that all about?
It's called the 3P program is what we have it. It's actually administered by your carrier, by your company. And frankly, if you're using a drug that costs over $600 a month for the drug, they're going to reach out to you and say, you really should consider the 3P plan. Pharmacists may even recommend it to you. So you enroll through the company. We agents can't enroll people in it, but they are going to reach out to people. And what it does is evens out your payments for the year. And the amount each month can change because it depends on how you're getting your drugs. But it really helps seniors so that if they're taking a drug where you have a hit of maybe the drug costs you $3,000 or $2,000, they're going to even that payment out for 12 months. You don't pay it at the pharmacy, you're billed by the insurance company for that amount. And so it really does help a number of seniors to even out their costs. So one of the great things this year is the maximum out of pocket has not increased that much. It's gone from $2,000 to $2,100. So that means your true out of pocket cost, we call it TROOP, will be $2,100 next year for your drugs. So what the 3P program is saying is we're going to even out that payment of the $2,100 basically, depending on your drugs, over the 12 months rather than you getting all hit right up front in those first three or 4 months. I know in my husband, it's May. Usually we've got to pay a lot of drugs till May. Other people, it may go all the way through to the end of the year. So,
and they should be aware of that too, because they may not be expecting to get a bill for that sort of thing in the mail for the monthly payment amount, right? So
if they set it up,
make sure to open those envelopes that come in from your carrier and make sure that they're aware of that. Well, what about changes for individuals who are on Medicare and decide to change their plans? I know we talked about this last year. What types of changes are available there? What do they need to know?
Well, to actually change your plan, you can work with an agent. You can work directly with the company. And so we have some rules. We have to have you sign a scope of an appointment. So you have to give us permission, and then we can work with you 48 hours later to go over the plans. You have to provide a scope of appointment. Otherwise, we cannot discuss the plans with you. We do have to record our phone calls with you. If we're meeting in person, we don't. But we do have to record the calls in total, and we keep a copy of that for 10 years. Nobody listens to it unless there's some issues, but just be aware, it's just like when you call customer service and they say for quality purposes.
Right.
Well, this is for quality and compliance purposes. You will be recorded. If you refuse to be recorded, then we have to meet in person, or we have to only speak through email on the things. It's a very strict rule that Medicare has about this, and companies do monitor it.
Yeah.
So just be aware you have to provide a scope of an appointment for us to do the benefits.
And if someone wasn't told that and they went ahead and enrolled, there are issues there too, because obviously the agent that they are working with may not be compliant, correct?
Correct. And the agent can be subject to penalties, retraining, or even lose their license.
Wow.
Over that matter. Part of it is, and the reason why that came about is through COVID, we had so many predatory offshore marketing people calling, and they moved people from plans without checking with their doctors, without even having people realizing they were enrolling into a different plan. So CMS had over 42,000 complaints of that kind of activity.
Wow.
So this was in reaction to that, to correct things. Yeah, there always will be bad actors.
Yeah.
And this was a reaction to that. So seniors, what it's designed to do is to protect you so that you are giving us permission to speak about specific things. I'm not selling you the Brooklyn Bridge. I'm not selling you annuities or life insurance or talking about other things. We are specifically talking about the products that are the Medicare plans. So we want to make sure we pay attention to only that and not slide anything else in. It's protecting you.
Right, right. Well, we mentioned this, or you mentioned this before, but I want to come back to it because it's important, especially right now. Actually, it's going to be a little late by the time this podcast is actually released, but it's still important just overall. One thing that you and I both wanted to remind people about was the creditable coverage issue, which you mentioned earlier, but I want to come back to that. For employers with plan participants near or at retirement age, less group plans are now going to be considered offering creditable coverage, and notices for that were supposed to go out by October 15th to let their participants know that are 64 or older whether or not the group plan that's being offered is creditable coverage or not towards Medicare. So hopefully employers did that. Hopefully people went ahead and checked that, because from what I understand, there are basically some differences on what plans are qualifying this year. Just because your plan was a creditable coverage plan last year does not necessarily mean that it's going to be creditable coverage this year. And there are a lot of things that can affect that. Do you have any comments on that? Would you like to share any information on that so that people are aware of those creditable coverage notices and how important those are for people knowing, what decisions they need to make during open enrollment?
This is very, very important. Let me stress this. Mm-hmm. We cannot ignore it. So what has happened is, with the change of the Income Reduction Act, they moved what the definition of the maximum out-of-pocket was, so that going from a max out-of-pocket of $8,000 down to $2,000 means that it's difficult for the group insurance plans to equal what the Medicare Part D plans. So we call it creditable coverage. It has to be equal. There's all actuarial formularies and so forth, but it's basically saying it's equal to the $2,000 max out of pocket and 25% paid by the individual, 75% paid by the insurance company. So if the plan doesn't meet that criteria, it's non-creditable. And so our concern is a lot of the bronze plans do not. Right. There are a few of the silver plans that do not. So what does that mean to a senior? We call them working aged. What does that mean to them if you get that notice? Well, basically what it means is you need to get onto Part A of Medicare. Anybody can enroll anytime in Medicare. For Part A, you just call Social Security. And then during this open enrollment period, and this is why it's so important, so from October 15th to December 7th, you will need to enroll in a standalone Part D plan. And so your group plan will be primary, always will pay first. Why are you doing that? Because if you don't, when you finally leave your group insurance plan and you go on to Medicare, they're going to say, oh, you didn't get prescription drug coverage when you were eligible to get your prescription drug coverage. So we're going to fine you 1% of the national average of the plan's cost for the rest of your life. Mm-hmm. So it's 1% for every month. So for example, let's say you're 65 and you retire at 68, that's 36 months time the going rate. So if this year the going rate is 36 cents a month, that's 36 times 36 cents, which you'll pay for the rest of your life.
Right.
So it's a penalty.
Yeah, it's
so
a penalty.
That's why.
It may not be a huge penalty, and it may be very little to some, but for some, every dime counts because they're on very, very fixed incomes, right? So
and the maximum is 120 months, just so you know. There is a max.
Okay. Thank you for that. But I wanted to bring this up because employers are supposed to do this, and they may not have realized that the rules change and that their plan that was always considered creditable in the past may not be considered creditable today.
Mm-hmm. And the thing is, with the loss of this coverage, it's not a special enrollment creditable, so that's why we're stuck with that October 15th through December 7th. So I'm really concerned. I'm going to get a lot of calls in January, and I have to do, and I kid and I say the Brenda Lee "I'm Sorry, So Sorry" song, that it doesn't match with the enrollment period. So there's a plan for zero premium out there, people.
Mm-hmm. Yeah.
There's some plans with less than $10 a month.
Yeah.
So, and you do get the drug coverage. So there's some options out there. So this year it shouldn't be as painful.
Yeah. And for the employers out there, there are two separate notices. One's for credible coverage and one's for not credible coverage. So last year and in the past, if you've been saying, yeah, it's credible, then you find out, it's not credible, then you have to make sure that you get the non-credible notices out this year instead of the same notice you had last year. So double check that. And anything, employee contributions, all sorts of things can play into this is to determine whether or not it's credible coverage. So again, make sure that's checked before you get those notices out. If you've already done the notices and they're wrong, you better get on it really quickly and send out revisions as quickly as possible so that people have the opportunity to enroll during this period in a different plan if they need to, if it is determined non-creditable when you thought it was creditable. So timing is of the essence. Make sure that happens. And that's why both Maggie and I thought it was really, really important to talk about this during this podcast today. So thanks, Maggie. I appreciate that. Let's talk about the new CMS final rule for 2026. Which has broader oversight, including expanding the definition of marketing to include more types of advertisement and material, subjecting to review before the use of both Medicare Advantage and Part D plans. So why don't you tell us about this? Explain it to everyone so that they understand.
Oh, Big Brother is watching. And it's really to protect the seniors. So what they're saying, it used to be, and that's why you saw these wild advertisements on TV, they were called file and use. So they could take and just file that, but go ahead and use it anyway without hearing from CMS and the carriers until they would tell them, oh, you have to pull it or not pull it. Now CMS, that's Centers for Medicare and Medicare, has said, no. We need to approve anything first before you put it on the air, before you print it out. And so I think you'll notice this year when you're hearing the ads, they're not quite as wild as they have in the past, that they're much more to the fact and talking about benefits in that. And that is because CMS is saying, we're looking at it first, and the carriers are saying we're looking at it first. So anything that's TV, internet, direct mail, social media has to have approval. Agents have more responsibility placed on them to document, to make sure that we are in compliance at all the time. We have to make sure that we are not making any false promises. We have to make sure that any materials that we use have been approved by the company and by CMS. We have to make sure that you have a clear understanding of what we'll be presenting and that you have given us permission to present that through that scope of an appointment that I mentioned earlier. We also have to make sure that if you are a lead, if you had called in to get information, you're considered a lead. Those leads can't be sold to 20 different people. It's only specific to people, and they will tell you who will be working with you on that type of thing. It's what you call the data sharing consent, that is new. Also, agents have to tell you if they're paid a commission or not paid a commission. They don't have to tell you how much, but they have to disclose that they will be paid a commission for helping sign you up for a plan or not being signed up. Also, for agents who may refer other agents, we have a limitation on referral fees. We cannot pay over certain amounts. So that is a set requirement as well. So some of the things Medicare is making sure that we're doing is we're playing fairly in the playing field, and that you are protected and receiving the information that the companies have approved and that CMS has approved.
Great. Thank you for that information. And my next question, I think you answered a lot of this already, but I'm going to come back to it just in case there's one or two additional things you want to add to that. I was going to ask you to tell us what the impact is for agents, brokers, and plans related to the CMS final rule for 2026. Some of that I think you just covered, but is there anything else you want to add to that?
Well, you'll notice I'm recording everything. you'll notice I will be taking a lot of notes, making sure that we're clarified on these type of things. One of the things that I do is I send follow-up letters to my clients, especially after we've enrolled, and notice the points that they're really concerned about or mention that, and give them disclosures in the letters, making sure. One of the things that people have missed too is agents should be disclosing to you about privacy. And I know Dorothy and I have talked about this too. Privacy disclosures are important. We protect your data. We lock up your information in files. We don't have them sitting in the cars. If they're in the car, they're in the trunk locked up. So if we lose a computer, oh my goodness, we've got a lot of reporting to do on that type of thing. So it's all about giving you HIPAA protection. It's about protecting your data, whether it's when we're talking face to face or we're doing Zoom calls or whatever we're doing. And also the paperwork has got to be locked up and safe. So a lot more protections for you people. And we want to make sure that's done because we do not want to lose any of your data out into that dark web.
Right. Are there any other updates that you'd like to provide for our audience? I understand that obviously the compensation for producers, which we talked about in the beginning, was one big change. What else is going on? Is there anything else that you want to add to this that's important for people to know?
Well, there's a bill in Congress. There's a couple of things going on, and this is more towards the agents, but I want employers and people to know. Dorothy and I are a member of the association, NABIP. We have been actively working for our clients for representation to make sure they're getting the best coverage they can, but also protecting the agents. And there is a new bill that has been introduced by Mike Rounds, who is a senator out of the Midwest and also with a senator from Nevada. And what it's doing, it's a legislation to support seniors' access to Medicare enrollment assistance. So what it means is they want to make sure that brokers will still be around to be able to help people enroll into Medicare plans and to provide ongoing service as their trusted advisors. And so they are working so that agents have access to all the information they need and that we're not encumbered in trying to provide service to people. So in other words, they're pulling us out of that definition of third-party marketing organization, recognizing us as trusted advisors, making sure that we don't have to do a 48-hour requirement for a scope. It's kind of like, oh, I want to buy a car. Well, wonderful. Sign this paper and come back in 2 days and I'll sell you a car. So we don't mind having the scope of appointment sign. It's just not being able to talk to you for 48 hours. That's just silly.
Yeah.
And so that bill will take away with that. We're still working on the COBRA bill. We're still trying to get the Part D part of the OEP. We haven't made some moves in that, but at least they're talking to us, and it's exciting that this broker bill is not being lost in all of this discussion of the budget and everything. It's included with it. It's not being tabled, folks. So Senator Rounds is really working hard to protect us all and working with the fellow senators, and I'm very grateful for that. And having worked on a committee for that for 2 years, it's kind of fun to say, hey, you can make a difference.
Yeah, and we may be able to accomplish something after all, after all of this.
Yeah, and so what I want to say to you, people, work with your representative. If you're concerned about something, communicate with them. You can make a difference. And this is a sample of this. I'm not just talking as representative of my association, but as an individual, you have a voice. Mm-hmm. And especially those that are seniors, oh, you got a big voice. So we make a difference, people, and I'm so proud that this bill is moving forward. I just had a little piece in it, but I'm just thrilled to it.
Well, thank you for doing that. I know that you're on the committee and you work with NABIP and you're part of the team that's putting the recommendations together and going out there and talking to people, talking to legislators and so forth to make sure that they know what's important and how all this stuff works and how it kind of all filters down to the end user, the consumer, the Medicare recipients. So I just want to say thank you, because without people like you doing that, that's nothing would get done really in anyone's favor. I mean, the last thing we need are legislators making decisions without the input of all the people out there and who it affects. And so that's great. So I, again, just thank you very much for that. And we're about out of time today, but I just want to say thank you again, as I said a zillion times already. Thank you very much for being with me today. If anybody should want to reach out to you, how would they do that?
Well, you can email me, and that would be great. I'm at mstedt@stedtinsurance.com.
And you want to spell your last name for everyone?
Oh, yes, because it's hard to hear. It's S as in Sam, T as in Tom, E, D as in David, T as in Tom, or Google me and it'll take you right to my website as well.
Great. Thank you very, very much. For everybody else out there, please stay safe, stay healthy, and stay tuned for the next episode of the Benefits Executive Roundtable. Thanks, everyone.
Thanks for watching. Stay tuned for compliance tips, cost containment ideas, new trends, and decision-making tools. This podcast is produced by Advanced Benefit Consulting, Fullerton, California. All views expressed are those of the host or interviewees and not necessarily those of Advanced Benefit Consulting. Information contained herein should not be construed as legal advice. We always recommend that you consult with your legal counsel as situations do vary. Ms. Cociu can be reached at 714-693-9754 extension 102 or toll free at 866-658-3835. By email at dmcociu@advancedbenefitconsulting.com or visit our website at advancedbenefitconsulting.com.